So I have Shrey Patel, Dr. Shrey Patel. He is one of our former fellows. And can you kind of introduce yourself and what you're doing now?
Hey guys, I'm Shrey Patel. I was the Thoracic Surgery Fellow at Temple University from 2018 to 2020. Um, After my fellowship at Temple, I decided to do an extra year to get additional training in aortic and endovascular surgery at Cleveland Clinic. So I did that from 2020 to 21. And now I've joined a private practice group who's affiliated with Michigan State University. There's a group of 9 of us surgeons here in Michigan. So now I do everything. I do cardiac surgery, thoracic surgery, mostly cardiac. My interest has been cardiac and aortic. So most of my practice is now cardiac surgery, but I still do VATs and robotic lobectomies. Um, so
And how prepared did you feel to go out into practice, both after the fellowship at Temple and after the fellowship at Cleveland?
yeah, so without question, after the fellowship at Temple, I was ready to do thoracic surgery. I think Temple is, back then it was, and I think it still is, the top 5 thoracic surgery programs in the country. Cardiac, it's hard to say because you're never really ready. You could do 2 years, 3 years, 4 years, 5 years, and you're never really ready. But I wanted to do an extra year of aortic just to have a niche. And I think there's a lot of good things that I got at Cleveland from doing aortic surgery. I learned a set of skills that I didn't necessarily learn at Temple, which was endovascular surgery. And I think that's going to be the future. So after Cleveland, I felt pretty ready, as ready as I could be from the cardiac side. Um, you're never really truly ready when you think of cardiac, but
So yeah, you mentioned that one of the great pluses is the thoracic surgery experience, of course, the transplants experience at Temple as well. But what would you say are some weaknesses of our program?
yeah, so from the thoracic side, I can't really think of much. I came into this private practice group as a cardiac surgeon, and my partners are still shocked that I'm doing VATS lobectomies. Most of them do it open and robotic lobectomies. So from the preoperative workup to the OR to postoperative care, thoracic surgery, I think I got a really good experience. From the cardiac side, there was a couple of things I wish I had gotten at Temple. And I think this is kind of an inherent weakness of not just Temple, but probably most cardiothoracic surgery training programs around the country. And that's the preoperative exposure to cardiac surgery patients. And there's just not enough time, I think, in 2 or 3 years to learn all of that. And most of the time on the cardiac side, you want to be in the OR, you're excited, and you'd rather not go to clinic and just get the OR exposure. And even in Cleveland Clinic, we didn't spend a lot of time working up patients. There was an army of people that worked up patients in the preoperative setting. Most of the times you just looked at the cardiac cath and met the patient in the OR. But one of the things I wish I had learned, now that I'm new and attending, is, not every single patient is a candidate for cardiac surgery. And so I wish I had spent some more time working up cardiac surgery patients in the preoperative setting. And then one of the other things is when I was at Temple, all the surgeons did their CABG off pump. So, which was great because 99% of fellows that are graduating programs now are not getting off pump training. And I would say a majority, greater than 90% of the surgeons in the country aren't doing off pump anymore. So it was great to get that exposure to learn off pump surgery. But we didn't have any surgeons that did on pumps car cabbages. So that was one of the things I wish I had at Temple, but it wasn't a problem for me because I, did everything on pump at Cleveland. And so I got that exposure at Cleveland Clinic.
Yeah, and since you graduated, we have recruited Dr. Mukashi, who does everything on pump. So we definitely have that more diverse experience. But yeah, I think it is a struggle to get people to clinic, even on the thoracic side, even on the cardiac side across the country. So something that we will improve. And um, so how did you feel, uh, your preparation professionally, like how to prepare for your next job, how to prepare for your fellowship, how to prepare for practice? How exactly did you do that?
Yeah, coming out of Temple, I mean, I had really good general surgery training too, but coming out of Temple, that wasn't a problem. We saw your Temple is an inner city hospital. You see a lot of sick patients. And so the patient population at Cleveland wasn't any different. I mean, if anything, there were more complex cases, but better patients. So I felt ready for advanced training. And then when I finished both my fellowships at Temple and at Cleveland, I was excited, but also nervous, as anybody would be, to start a job, and my first job as an attending. But the important thing is you have to find a place where you fit in, where you're going to have support, whether it's academics or private, and the people that you're around are supportive of you. And I mean, you're always learning, and that's the thing. Everybody makes mistakes. That's, no, some of my partners are like, I'm 30 years in and I'm still learning. And that's why they call it practice, the practice of medicine. So I was well prepared for the real world. And luckily I found a group that has been very supportive.
So we're talking about transitions, to fellowship and advanced fellowship into practice. What kind of advice do you have for people as they're looking at cardiothoracic fellowships, and what factors do you think are valuable, and any advice on choosing the right cardiothoracic fellowship?
Sure. It's hard to gauge, a fellowship based on a two-day interview or your experience. And sometimes, it's things change. But what I will say is when you're a fellow, you're focused on different things. You're focused on learning how to sew the anastomosis. You're learning how to operate. And there are things, I mean, you don't even know what you don't know when you're a fellow. And so what I will say is that uh, I wish that I had paid more attention to minor detail. So all the people that are going into cardiothoracic surgery, I would say that when you're a fellow, it's important to learn how to sew, but pay attention on how to set things up. You're going to get a variety of attendings that do things in different ways, and you're going to learn how to do something 4, 5, 6 different ways. And eventually, the good part is when you become an attending and you're on your own, you get to pick and choose and have your way of doing things. But it's important that while you're going through the process that you take notes and pay attention to the small details. Where your assistant's standing, or what are they doing at each moment in the operation, how you're going to communicate with them when you're the one in charge and you don't have an attending supervising you. What are you going to do if the vein's not good enough? What's your backup plan? So as you're scrubbing these cases and learning how to operate, you also got to be thinking about each step of the way. If something goes wrong, what am I going to do different? And pay attention to the small details, like, how is your attending measuring the length of the vein when they're doing the cabbage? Or how is the assistant holding the vein while you're sewing? So I think that's my biggest piece of advice, is that when you're going through it, it's all new and you're trying to learn how to operate and you're in the moment, but pay attention to the small details and take notes, because that's going to be important. And one day you're going to look back and look at your notes and say, oh, okay, this is how Dr. So-and-so did it. And I like the way he did it. So I'm going to do it that way when I'm on my own.
Yeah. And so now we're doing Zoom interviews, as you know, because of COVID and how things change. So that's a little different from when you were interviewing and choosing programs. Any advice on choosing cardiothoracic programs from, the incredible, this, diversity and geographic diversity and missions of programs?
Yeah. it's hard to say, I guess I was lucky that I was able to do it in person, but we live in a different world now. So I think the most important thing is to try to talk to the attendings and ask questions. And a lot of interviews you go to, people say, do you have questions? And most of the time you're like, I don't have any more questions. I'm sick of this process. But ask the questions that they don't want to hear. you know what are your fellows doing when they get out? What are they doing? Which side are they standing on from day one? What parts of the operation are they actually doing? And things like that. So I think it's important to ask those questions. Nobody's gonna look at you negatively and say, oh, this guy or this woman was so straightforward and asked all these questions. I mean, it's important to get to know the program. You spend 2 years, 2 or 3 years of your life at a place. You want to know where you're going to end up.
Great. Well, I can tell you, I speak for the whole faculty. We're so proud of you and just excited about your position, your job, your success. And, we love being able to connect with you. And we do really appreciate your spending the time and sharing your experiences. I think none of us are perfect, and we are still learning. And even though we're graduating great, cardiothoracic surgeons like you, we can always improve. So it's helpful to get this honest feedback and advice so that we can help future fellows. So again, Shrey, thank you so much for your time today.
Absolutely. Anytime.